Cancer is the second driving cause for death in the United States. In 2015, cancer ended the lives of 595,930 individuals, equaling 22% of all passings in the United States. As indicated by the CDC, this number keeps on rising, and it was assessed that before 2017 is over, cancer will have taken more than 600,000 lives last year. According to the Agency for Healthcare Research and Quality, in 2014, $87.8 billion was spent in the U.S. related to healthcare-provided services stemming from cancer. Genetic screenings are accessible to help patients fight the war against the disease. Early detection of cancer helps to assign the proper treatment and heighten survival rates. Early disease testing is accessible for various kinds of malignancies. Genetic testing for predisposition and early detection have positively adjusted the survival rates from various types of cancer growths by up to 35%. As per the National Institutes of Health, genetic cancer screenings offer multiple positive outcomes, as in increased survival rates as well as possibly lowering healthcare costs for both patients and providers. What is genetic screening? Genetic testing is a type of medical screening that identifies changes in genes, chromosomes, or proteins. The finding that are discovered during a genetic test can affirm or rule out a suspected genetic condition or help ascertain a person's chance of developing or passing on a genetic disorder. There are more than 1,000 genetic tests currently in use. Enhancing outcomes. The essential objective is distinguishing proof of the highest risk cancer populations and early growth cancer screening of patients to decrease mortality. Proper early screening may modify mortality rates as well as offer a possibility for a prolonged and offer better quality of life for the patient. For instance, breast cancer is one of the main sources of death among women with a malignancy. Insights delivered by the National Cancer Institute have demonstrated that women who experience a standard mammogram lessen the danger of death by 15% to 20%. Generally, screening consistency is low, implying that the quantity of people who ought to be tested for specific growths isn't ideal. For instance, in 2014 the CDC showed that only 65.7% of patients older than 50 had colon malignancy screenings, while 27.3% had been screened at all. Investigators at the University of Michigan found that at-risk individuals that had a colon cancer screening could prevent 90% of a cancer diagnosis. According to the CDC, 9 of 10 patients who discovered colon growth through normal screening were still alive 5 years after the initial diagnosis. Additionally, people with a malignancy that took part in counteractive action program, like way-of-life adjustments and that stopped smoking, could receive reduced out-of-pocket costs and lower healthcare benefit premiums in some instances. Early detection and treatment before metastasis can positively alter treatment and results as well. New genetic screen tests are coming. Researchers at Johns Hopkins University in Baltimore, Maryland, led another strategy for malignancy identification known as target error correction sequencing. It is utilized to recognize even the most reduced levels of circulating tumor DNA, which is ordinarily discovered in those with early-stage growths. In the examination, 200 samples were taken from people with colorectal, breast, ovarian, and lung cancer, which distinguish 62% of stage 1 and 2 tumors. What's also worth mentioning is that no false positives were found in 44 healthy people who were tested. Different biomarkers have been recognized for a large group of growths, including breast, colorectal, lung, ovarian, and prostate. In 2016, 15,000 patients with 50 unique kinds of tumors experienced liquid biopsy screening, yielding perceptible changes in 6 distinct sorts of biomarkers. For example, the epidermal development factor receptor communicated in later-range lung growths, and proto-oncogene BRAF, which has been connected to an expanded occurrence of melanoma, with 94% to 100% specificity of comparative tissue biopsies. This could take into account potential focused on treatments intended for gene-specific malignancies to be customized and treatment options for those not already qualified. Liquid biopsies could help decrease the danger of disease re-manifesting by finding circulating DNA after colon growth surgery. In 2016, researchers found that by reviewing the metrics from tumor DNA from the blood of patients with stage 2 colon cancer, they could predetermine which patients would be at a higher danger of a recurrence from any lingering residual circulating DNA from the tumor. The individuals who had circulating tumor DNA after surgery will probably endure a repeat diagnosis. Individuals who then had genetic liquid biopsies after the cancer extraction would be better equipped to evaluate enhanced post-operation treatments. A liquid biopsy then may be an affordable non-invasive way to help recognize the individuals who could benefit from post-operative chemotherapy.